Embolism is a serious medical condition where a vessel is blocked by an embolus, a mass that moves through the bloodstream until it gets stuck. But what exactly can an embolus be made of? A dislodged blood clot, also known as a thrombus, air bubbles, amniotic fluid aggregates, fat particles, bacteria or cancer cells, and even foreign substances. No matter how small, an embolus will eventually get stuck in a vessel too narrow for it to pass through. Where it originates determines whether it blocks a vessel in the lungs or the rest of the body. Pulmonary embolism originates in the veins, usually the deep veins of the legs, or from the right side of the heart. Arterial embolism comes from the left side of the heart and is linked to conditions like heart attacks, valve diseases, heart failure, endocarditis, and abnormal heart rhythms. When an embolism blocks blood flow, tissues beyond the obstruction are deprived of oxygen. This leads to ischemia or infarction. Key symptoms include pale, waxy skin due to lack of blood, and numbness and pain from nerve damage. Organ-specific effects. When an embolism occurs in the lungs, known as a pulmonary embolism, it can lead to chest pain and difficulty breathing. In the kidneys, a renal artery embolism can cause abdominal pain and reduced urine output. For the intestines, a mesenteric embolism results in severe abdominal pain and bowel paralysis. If the heart is affected, a coronary embolism can cause heart attacks. And finally, a cerebral embolism in the brain can lead to strokes. Thromboembolism is caused by a dislodged blood clot. This condition often originates in the heart due to issues like atrial fibrillation or heart failure. It commonly affects the legs, heart, and brain. Air embolism occurs when air enters the bloodstream, often through IV lines or chest injuries. This can block blood vessels, leading to tissue death. Amniotic fluid embolism occurs during labor when amniotic fluid enters the mother's bloodstream. This can trigger inflammation and clotting, affecting the lungs and kidneys. Bacterial embolism is caused by clumps of bacteria from infections, often in heart valves. These clumps can travel through the bloodstream and block vessels. Fat embolism often results from bone fractures. Fat particles enter the blood and block small vessels, particularly in the lungs. Foreign matter embolism is introduced through trauma or medical procedures. It can include drug precipitates, glass shards, or fibers from medical equipment. This triggers clot formation, leading to blockages. Embolisms can be life-threatening, but awareness and prevention can save lives. Knowing the risks, recognizing symptoms early, and seeking medical attention quickly are key to managing this condition. Stay informed, stay safe, and take care of your heart and blood vessels.